my name is Lacey McCoy. I am a stroke prevention nurse navigator, and I'm going to be talking to you today about the link, risk factors, and prevention between diabetes and stroke. So first, I want to talk to you about our program. The stroke prevention program is funded through the Good Health and Wellness in Indian Country grant, and we do this in collaboration with the Southern Plains Tribal Health Board. Our goal is to strive to help Native American patients living with diabetes reduce and manage their risk factors for stroke. Within the program, patients have access to nurse-led education classes, blended online and in person for more accessibility, as well as availability to experts in nutrition, in exercise, and smoking cessation. Other program features that we have are a blood pressure monitor and tracking services for blood pressure awareness, cardiovascular risk assessments, healthy lifestyle education and demonstrations, and Fitbit for increased physical activity tracking for qualified patients. So let's talk about what a stroke is first and foremost. A stroke is sometimes called a brain attack, and it happens in two ways. The first is an ischemic stroke. This is the most common. This happens when a blood vessel is occluded, either by a clot or fatty deposits that have turned into plaque inside of your blood vessels and occlude blood flow to the brain. The second is a hemorrhagic stroke. This is when a blood vessel in the brain bursts and that blood spills out onto outside brain tissue, which then causes oxygen to be occluded from getting to the brain. A stroke causes brain tissue to die, and that leads to brain damage, to disability, and even death. Stroke is the fifth leading cause of death in the United States, and it is the leading cause of long-term serious disability. And what makes this so disturbing, those numbers so disturbing, is that 80% of strokes can actually be prevented. So let's talk about some of the risk factors of stroke. Like I said, stroke is preventable and treatable and beatable. Up to 80% of strokes can be prevented by just not smoking or using tobacco products, making healthy food choices, getting enough physical activity, maintaining a healthy weight, and treating conditions such as high blood sugar, high blood pressure, and high cholesterol. The first risk factor and the most common, the leading risk factor for stroke is high blood pressure. This is also called hypertension. And it is the single most important risk factor to stroke because it is the leading cause of stroke. A normal blood pressure is anything 120 and lower or 80 and lower. The 120 is the top number. This is the systolic. The 80 or lower is the bottom number. That is the diastolic. If you have been told that you have high blood pressure, work with your doctor to try to reduce this. We can do this in ways of diet and lifestyle changes, getting better sleep, changing sodium intake. You can increase physical activity. And we can manage these with medicine. And it's very important if you are put on medicine that you are obtaining home blood pressures and trying to work with the nurse or a doctor to stay on top of those numbers so that we can gauge if the medicine is accurately working or if there needs to be an increase or decrease. It is very important that you don't just get on medicine and never follow up with your doctor. It's just as dangerous for your blood pressure to be very low as it is for it to be very high. The second risk factor I wanted to talk to you today about is an irregular heartbeat. The one I will be discussing is atrial fibrillation, or AFib. AFib causes your heart's upper chambers to quiver rather than beating in an organized, rhythmic way, and this increases your risk of stroke up to 5 times. The fluttering of your heart may cause blood to pool and clot, and those clots can travel to your brain. Managing AFib is key to reducing your stroke risk. The third risk factor I wanted to talk to you about today is high cholesterol. High cholesterol is the increase of blocked arteries or causes blocked arteries. If an artery leading to the brain becomes blocked or throws a clot, a stroke can occur. The fourth risk factor is smoking or any tobacco product. Tobacco or smoking damages blood vessels, leading to blockages and stroke. Do not smoke or use tobacco products in any way, and avoid secondhand smoke. Smoking itself doubles your risk of dying after stroke. And if you smoke just 1 pack a day, this increases your risk for a stroke by more than 6 times than that of a non-smoker. Another risk factor is age and gender and race. The overall lifetime risk for a stroke in men has been calculated to be 1 in 6 and 1 in 5 for women. Men having higher rates in their younger years and women in their older years. Because of the longer life expectancy for a woman, each year 55,000 more women than men have a stroke. Per the CDC, the death rate in 2017 for Native Americans with stroke is 33.3 in men and 34.4 in women. Now we will talk about how to spot a stroke. And the way that we do that is through an acronym called FAST. F-A-S-T. F, face drooping. So if one side of the face droops or is numb, then that could be a stroke. You might ask the patient to, or the person you're with, to smile. In a smile, if one side droops, that could be a stroke. A stands for arm weakness. The quickest way to do this is have someone that you think might be experiencing a stroke to lift both arms. If you see one drooping, this could be the sign of a stroke. If you have weakness or numbness on either side, on just one side, that could be a stroke. But if you notice that arm drifting downward, that is a sure sign. S stands for speech difficulty. Is the speech slurred? Are they unable to speak, or are they hard to understand? Have a person repeat a sentence, just a simple sentence, like the sky is blue. Is this sentence repeated correctly? If it's not, this could be a sign of stroke. And last, T, which is the most important, time. Time to call 911. If a person shows any of the signs of these symptoms or others, even if the symptoms go away, call 911 and get them to the hospital immediately. We always say that time is the brain damage. It causes brain damage further. The more time, the more brain damage. The quicker that we can get someone to the hospital and get medicine on board saves brain. Other symptoms that might go along with or coordinate with a stroke are sudden numbness and weakness on, like I said, either side of the body or in the leg, sudden confusion or trouble understanding, sudden trouble seeing in one or both of their eyes, or vision blurriness, sudden trouble walking, dizziness or loss of balance or coordination, and a severe headache with an unknown etiology or an unknown cause.
What is diabetes and how is it linked to stroke? Diabetes is a condition that causes blood sugars to rise to unhealthy levels. Untreated diabetes can lead to serious medical problems, including heart disease and stroke. In diabetes, the body has problems either using or making a hormone called insulin. Insulin is important because it helps the body's cells to take sugar from the blood and turn it into energy the body can use. When the body does not have enough insulin, or it does not respond to the insulin, it causes too much sugar to build up in the blood, which can cause damage to your heart and other parts of your body. More than 30 million Americans have diabetes. Diabetes is the 7th leading cause of death in the United States. Occurrence of diabetes is higher among American Indians, Alaskan Natives, non-Hispanic Blacks, and Hispanic and Latinos. Adults who have diabetes are 2 times likely to have a stroke compared to those who do not have diabetes. People with diabetes tend to develop heart disease and have a stroke at an earlier age than people without diabetes. People with prediabetes have an increased risk not only for developing type 2 diabetes, but also for heart disease and stroke. Every 2 minutes, an American adult with diabetes is hospitalized for a stroke. Knowing this is why it's important to understand the connection between diabetes and stroke and recognize the risk factors and take the steps to stay healthy. The connection between diabetes and stroke has a lot to do with the way that the body handles blood glucose to make energy. Most of the food we eat is broken down into glucose to give us energy. Glucose enters a person's bloodstream after food is digested and travels to cells throughout the body. For glucose to enter the cells and provide energy, it needs a hormone called insulin. The pancreas is responsible for producing this insulin in the right amounts. In people with type 1 diabetes, the pancreas does not make insulin. In people with type 2 diabetes, the pancreas makes too little insulin, or the muscles, the liver, and fat do not use them in the right way. As a result, people with untreated diabetes accumulate too much blood glucose in their blood, and their cells don't receive enough energy. So over time, excessive blood glucose can result in increased fatty deposits or clots in the blood vessels. These clots narrow or block blood vessels in the brain or neck, cutting off blood supply, stopping oxygen from getting to the brain, and causing stroke. Risk factors for stroke in diabetic patients: uncontrolled high blood sugar, high cholesterol, use of nicotine or tobacco products, secondhand smoke, excessive use of alcohol, not being very active or having limited physical activity, high blood pressure levels, or increased waist circumference, which in men is 40 inches and in women is 35 inches. What can you do about it? Maintain a heart-healthy diet, lower your cholesterol by using diet and exercise, and if needed, medication. Maintain a healthy relationship with your healthcare professionals for your management of your diabetes and to be proactive in your care. Maintain a healthy weight. Reduce your alcohol intake to a healthy level. Do not use nicotine and avoid secondhand smoke. Try to get exercise every day. A little bit is better than nothing. Maintain a healthy A1C, which is at or below 7%, and maintain a healthy blood pressure level. Uncontrolled high blood pressure can lead to stroke, heart attack, heart failure, and kidney failure. In the average healthy adult with no risk factors, normal blood pressure is considered to be less than 120 over less than 80. For people with certain risk factors such as diabetes, those are a little different. So your goal would be more of less than 130 over less than 80. But always, these are guidelines. Always remember to talk with your provider. If they give you specific guidelines, always go by those. How does high blood pressure increase the risk of stroke? Over time, high blood pressure increases your heart's workload and puts damage on your arteries and other blood vessels and organs over time. So compared to those that are healthy with normal blood pressure, high blood pressure people are more likely to have a stroke. About 87% of strokes are caused by narrow or clogged blood vessels in the brain that reduce the oxygen flow to the brain cells, which is called an ischemic stroke. High blood pressure can, over time, cause damage to those fragile little blood vessels around the brain. And in about 13% of strokes, those little bitty blood vessels can rupture in or near the brain. And this is called a hemorrhagic stroke. So there are two different types of strokes. Most commonly, it's an ischemic stroke, which is a lack of oxygen to the brain. Chronic high blood pressure or aging blood vessels are often the main causes of a hemorrhagic stroke. So even if you have had a prior stroke or a heart attack, controlling your high blood pressure can help prevent another one. So make sure that you're taking these steps, whether you've had a stroke in the past or not. Avoid nicotine and avoid secondhand smoke. Reach and maintain a healthy weight. Eat a healthy diet low in sodium and saturated and trans fats. Limit your sweets, red, and processed meats. Eat fruits and vegetables. Eat more fruits and vegetables. Switch to whole grain breads. Eat low-fat dairy products. And choose lean cuts of meat such as poultry and fish. Also, increasing things like nuts are helpful. Make sure that you're including foods rich in potassium. Be physically active. Aim for at least 150 minutes of moderate activity per week. Remember, a little bit is better than nothing at all, so start small and have an ultimate goal to work up to 150 minutes. But some moving is better than no moving, so just get moving. Limit alcohol to no more than 2 drinks a day if you're a man, and 1 drink a day if you're a woman. Take all of your medications as prescribed to control your blood pressure, and know what your blood pressure should be and try to keep it at that level.